I could go to work and be that carefree nurse that was taking care of the sickest patients, and I wasn't anxious. My coworkers were even telling me that I seemed less anxious. I was this superwoman at this point. And I feel like this happens to other people too. And then they're like, this medication saved my life. How dare you talk about this? And my response usually is, okay, that I'm so happy for you, but this medication destroyed my life.
Okay, hello, I'm Daniel from Inner Compass Initiative. Welcome to ICI Stories, where we let people take back ownership of their own stories. Many of us, when we were going through psychiatrization, end up often, without realizing it, handing over control of our stories to the mental health industry. We let them define what is happening to us and why. We take on their language and their concepts and incorporate them into our identity. For some of us, at some point, we start to feel that something is wrong, that the story we are being told about ourselves doesn't quite fit with the reality we're experiencing. Bit by bit, we start to question and probe that emerging sense of ourselves as narrators of our own lives, until eventually we are ready to tell our own story. There are many, many stories like this, and this is one. So today, I'm here to talk to Amanda about her story through the mental health industry and beyond. So just to start off with, Amanda, can you just tell us all a bit about your background, who you are, where you're from?
Okay, hello. My name's Amanda. I'm a nurse and I'm originally from Illinois in the US. I went through a bunch of kind of traumatic situations as a kid and just in family. I had my brother passed away like when I was in college. I was 20, 21, which kind of provoked my anxiety I was experiencing and what started all of this. But I used to be a travel nurse and now I work from home, dealing with withdrawal from one SSRI currently. So that's where I'm at right now.
I see. And how would you describe, so you've talked a bit about your background, but how would you describe your life before you first took that first pill? How was your life?
I think I had a really good life. I was a very social person. I am somebody who can always talk to anybody. People have told me, you've never met a stranger, is what they say. Um, but I feel like I definitely started having increased anxiety when I was like 19, 20 years old, like right when I started college. But I didn't know, I know now a lot of that had to do with my diet. I was drinking alcohol at the time and a bunch of other things that I never really paid attention to until obviously now I don't do any of that. Like I couldn't sleep in my own room for a long time, and thankfully my mom took me to counseling instead of putting me on medication or anything like that. But and I was able to get over that fear that I had through counseling. So I guess anxiety has always kind of been in my life,
Hmm.
um, but it wasn't like it was just I feel like everybody kind of has a little bit of anxiety
For sure.
baseline. That's just kind of normal. So.
Absolutely. And what was the turning point when you, so you said you didn't take any medication and you had counseling when you were younger, but what was the catalyst for you going on medication in the first place?
When I was 20, it was like a year or two before I graduated college. My brother, he had a stroke when I was in first grade. He was several years older than me, was in and out of nursing homes his whole life. So that was like stressful on me and my family to begin with. But then he abruptly passed away right before I turned 21. And so I think that was just like a traumatic incident in my life. And then I kind of just tried to push through it. Um, it really messed up my mom. Obviously, her son passed away. So that kind of put a bunch of pressure on our family. And so then I started a career in nursing when I graduated. And I kind of carried that with me the whole time. And then I entered my career thinking I was going to be okay. And I actually had a panic attack. I started in the ICU and it was cardiac ICU. So it was like one of the hardest places you can start as a new grad nurse. And I had a panic attack one day, and I had never experienced anything like it. My heart rate was like pounding. I stopped hearing, like I couldn't hear the doctor speaking behind me. And my peers around me noticed that something happened. And I did not know what this was. And I actually went the next day to a new primary care physician that I had never spoken to in my life. And I left with Lexapro in like 5 minutes.
Interesting. And just so when you, because this is quite an interesting thing, because there's often this debate about, going to that first appointment and what happens there. But in some ways, people talk about actually the decision about whether or not to take medication often happens way before that first appointment. Often people go in expecting a medication, or alternatively, it could be that the practitioner themselves is the one pushing the medication. So what was the case for you? Were you sort of like, okay, medication, I've heard that this helps a lot, right, this is enough, I want to get medication? Or was it like, I'm going with an open mind and the clinician was the one suggesting this?
I honestly think I went into that wanting a medication, but I had also been talking to a friend of mine from college who had been on medication. And I talk about this a lot with like my peers. I'm like, just because a medication worked for somebody else and they didn't have problems, that does not mean it's going to be the case for you. And I wish I had done like my own research about this, but I just listened to my friend who was like, this saved me, this helped. So I kind of was just like, I needed something that was going to allow me to be able to keep my job. And I needed something quick that was, because that's what I did when I was younger, in my early 20s. I just wanted quick fixes, which I feel like is what so many people want these days. And I was obviously, she did not tell me any of the warnings or anything. I did not know about withdrawal. And she actually said something to me that I will never forget. The doctor, she said, I think you've been anxious for so long that it's developed into depression.
That's really interesting. Yeah, because so often you hear about this where the prescribers or the clinicians, they fit you into a box rather than treating you as an individual. So they're like, okay, well, you've got X. Well, in that case, you must have Y as well, So what happened? How was the treatment for you? How was it taking Lexapro? Was it beneficial for you? Did you see any changes, positive and negative?
I almost wish I had a negative reaction so that I could have been like, take me off of this. But I didn't. It actually really helped me. I could go to work and be that carefree nurse that was taking care of the sickest patients, and I wasn't anxious. My coworkers were even telling me that I seemed less anxious. I was the superwoman at this point. And then my problems with it didn't really start until I was on it for like 3 or 4 years.
When I took the medication, for me, I felt it was beneficial for me as well. And what I notice in our community is, it's like once you go through a bad experience, like you flip completely, and it has to be all bad. And so in order to kind of validate the negative experiences people have, they also want to deny the fact that it helped them as well. And you get this kind of, people go the opposite way. So I think it's particularly interesting that it did help you at first as well. So what were these problems that were starting to develop with the treatment?
I was impulse spending on things that, like I tell people this example all the time, is I would order from Amazon and then it would come in a box and I would not open it for 3 months, and I would forget what I ordered, and then it would be time for me to want to return it, and I couldn't because it was past the return mark. So that's one example. Just kind of not talking to friends and family, like following up with them, just kind of, it almost seemed like I didn't care about anything.
Interesting.
And just my empathy, and then I went through the COVID pandemic and saw so many people in horrible situations because I was working in the ICU, and I feel like I should have cried, and I did not have the ability to cry. Now I cry all the time, but I could not cry when I was on my full dose of medication. Another thing was my memory. I started having memory problems. I was working night shift at the time. So a lot of times I was blaming it. I was like, is it because I'm working night shift or because I'm stressed about COVID? But it just kept going past all that. And I was like, something is not right.
Mm.
Um, I would be giving report because we give report about our patients to the next person. And I couldn't even remember my patient's name. Like, and then I would try to say a word and I couldn't find the word that I was trying to say. So definitely affecting my brain in multiple ways. The last thing was aggression and just anger. I was always angry, and I again, I thought it was just me. I was like, maybe I just need therapy, but it was like an anger that is not normal. Like I would get in my car and just like scream for no reason. I was so stressed all the time. I was never happy. And so I ended up getting like a workup done by this particular clinic I went to. They did a specific brain scan on me. Um, and it basically was showing impulse control, judgment, everything. A bunch of areas in my brain were impaired. And for some reason, they kept bringing up the Lexapro. They weren't saying that it was because of that, but they were saying this can cause this to be this way sometimes. And at first I was like, oh, there's no way like my Lexapro can be doing all this. And I almost stayed on it, but I'm so thankful that I ended up working with a psychiatrist from that clinic. And I was like, can we just try to like taper off of this and see what's going on, if this could be it. And sorry, I keep going all over the place, but another one was ADHD. That was a big one that I developed. I never had it as a kid, and then I could not focus on anything. And then I actually ended up getting diagnosed with ADHD, and then they put me on Adderall, but that just made all my symptoms so much worse. So then I ended up stopping the Adderall, started tapering off my Lexapro, which I am still doing, and I don't have those symptoms anymore. Like the aggression is gone. I'm able to remember to do all these things, and it's crazy the differences that I'm feeling now.
It resonates with my own story and many other stories I've heard. It sounds like at the beginning you felt pretty good, right? So how quickly did you start developing
Yes.
problems?
I feel like it was probably around the 3 year mark where I started like questioning
Okay.
things. But again, I had no idea it was the drug. I thought it was just me. It was like I started my taper at like 5 years on it. So that just shows how long it took me to get to that point.
Okay, so you went to this clinic, but obviously there must have been some sort of realization before getting to that clinic. I mean, the fact that you're going somewhere elsewhere outside of the mainstream mental health industry already shows that you're sort of questioning things a bit. So can you just
I was
talk us?
struggling, yeah.
Yeah. Can you talk us through the steps to that initial kind of suspicion, to blaming it on the Lexapro, and then moving to going to the clinic?
I was having gut issues too. I was having menstrual cycle problems, which I now know that people on Lexapro have a bunch of those issues as well. So I went there because not 100% knowing that something was wrong with my brain, but like listening to my body, seeing these outbursts that I was having, knowing it wasn't me, knowing it wasn't normal, which is why I tell my peers and people who are following me is to always listen to your body, because I had basically tried everything on my own first, and nothing was helping. Like even when I got supplements from this clinic, it was not helping. The only thing that helped was when I started to taper off the medication.
And what made you lose faith with? Because you placed your faith in this GP initially that gave you the medication. What stopped you? And then you were on Adderall at the same time now as well as Lexapro. So you got a prescription
Yeah.
cascade going on there. So what made you go, okay, I'm done with going to psychiatrists or GPs to solve my problems. I want to go elsewhere. What was it that made you give up on that sort of conventional treatment path?
I think it's just the poly drugging that I was lucky, honestly, and I always talk about this as well as someone's fate in all these situations is honestly dependent on who they go to, and the advice they get from, like, if their practitioner wants to listen to actually what's going on versus, oh, that's just anxiety, which in the withdrawal community, that's all we ever hear. They can end up on 10 different medications and then no one ever knows what's causing what. And I'm so thankful that I listened to my body and I was like, this Adderall is making me 10 times worse. But honestly, the psychiatrist that I went to, I'm still going to him to this day. And he at least kind of gets the tapering situation, but a lot of them don't. And the stories I'm hearing from people, and I'm sure you guys hear too, is so many doctors are just taking people off these meds, just cold turkey. And it's sad because I work in this, I used to work in conventional medicine, and I gave patients these medications. And so that was like a big wake up call for me as a nurse. And that's why I'm trying to speak out about it now.
So when you went to see your practitioner and you said you wanted to come off, what did they say to you? Were they supportive? Were they resistant? What did they talk you through?
Yes, so he was actually supportive because by that point we kind of were questioning if that was causing my problems. So he did not tell me to cold turkey, which I'm so thankful for. He told me to go down, but it was too fast. The way he told me, I think it was 10 to 7.5 to 5 to 2.5 to off, over the course of like a month or two. But I was so thankful he prescribed me the liquid, and I feel like that's a key in somebody's taper situation if they do have liquid available in their medication, because I was trying to cut those pills and every single time I was giving myself a different dose, which I think made the beginning a lot harder. So then once I got that, and he willingly ordered that for me, which I know so many doctors don't. But anyone who talks to me about this, I tell them, just like go in and say that you need it. Don't even ask. Just say, I need this. And then if they don't prescribe the liquid for you, go somewhere else.
I think we all know in the withdrawal community, and you've alluded to it, that despite the claims of medical professionals, mental health professionals, psychiatrists, GPs, that they know how to deprescribe, that is not the experience of the vast majority of people who in the withdrawal community. It doesn't matter what country you're living in, UK, US, Canada, Europe, whatever, it's a pretty similar experience. And so you have this kind of role reversal situation almost where the person coming to see the doctor actually, through their own research, knows more about how to come off these drugs than the actual person who prescribes them. And you get this kind of this sort of tension. So you were having these problems and you were realizing that the drugs were the problem. Had you already started to engage with the withdrawal community and sort of educate yourself about tapering and how to do it before you engaged with your doctor, or was that something that came later?
So no, I actually started, and then once I realized how awful I felt, that's when I started to reach out to the Facebook groups and surviving antidepressants and you guys and all that. But I feel like I don't know if I was taught it in nursing school that you have to taper these meds. I really don't think we did not go into depth if we did get taught. But I don't know if I heard it when I was in nursing school. Somehow I knew that it had to be tapered.
Okay, yeah, got it. I think something else that is difficult, and one of the reasons why doctors miss it, is obviously the people in the withdrawal community, we're the people that had problems coming off, right? But there are people that can come off even after a long period of time. Even cold turkey, I think, or like very quick tapers, they can come off and be completely fine, whereas other people will be absolutely devastated. So that does create a lot of confusion, I think, for doctors, because they're like, well, I took someone off last week, took them off in 2 months and they were fine.
He was fine.
Why are you having problems now? This must be on you. This can't be because of the medication. You get this kind of thing. So you followed the taper that your doctor had recommended, and I'm gathering from what you said this was problematic for you. Can you talk a bit more about that?
Yes. I had this really bad depersonalization, as a lot of us have, where I just felt like I was floating outside of my body whenever I would go do something. This is where withdrawal can be mixed with, like, people think they're getting diagnosed with something else, because I feel like if I went to the doctor, they would have done a million tests and they wouldn't have figured out what was wrong, because it's just so many symptoms that happen all at once. But basically, I could not leave my bed one day, and I had like a stabbing pain in my back. It was just such random symptoms. And I was like, I would go to work, I was sweating nonstop. I started craving, like, I remember I was still working at the hospital at this time, and I would pick up a pizza on my way home every single night. I had severe carb cravings, severe fatigue. But that stuff was manageable for me because that was at the higher doses. For some reason, 4 milligrams was my happy spot. So I stayed there on the liquid, 4 milligrams, for a whole year, because that's when I ended up leaving bedside nursing. I quit drinking. I had a bunch of like really good positive changes in my life. And I started, it took me a while to get somewhat normal after that. I was having dizzy spells when I was waking up and getting out of bed in the morning. I had a rash that developed all over my face. I did a bunch of gut health stuff, and I pretty much like healed after a year of staying on that dose. And then once I tried to go down from 4 this past July is when I started having the worst symptoms I've ever had.
Yeah. So tell us a bit about your experience when you were like when you went back to your doctor, or when you mentioned to other people within the profession or within the medical industry, you were, I'm suffering these horrific symptoms. What was their reaction to that?
So my doctor was actually supportive. I don't think he realized how bad it really was. A lot of doctors, I feel like they think it's like flu-like symptoms for a couple of days and that's it. But I think he definitely started questioning it a little bit more when this last time, when I tried to go down from the 4 milligrams and then the symptoms I was having, it just completely set my body off into dysautonomia and a bunch of physical, like really bad symptoms that can honestly really hurt or almost kill a person if they go through it. I could just tell he was so shocked that this was happening to me. And he actually tried to give me some tips to kind of help my vagus nerve and my because it really is just vagal nerve dysautonomia. So he was helpful, but I will say when I first started having these symptoms, I made a personal Facebook post about it. And this was like when I first started, so going down from 10 milligrams. And I made a vague post about it. And some nurses that I've previously worked with commented on it, and they said, you shouldn't scare people. These drugs are life-saving. And that's something I hear because I have a TikTok account and people comment that all the time, and I understand they can be life-saving, but we always say you don't understand it until you've been through it, and there's so many people who have been through it. So like you said, the validation of having these communities has been amazing for me, because my own mom doesn't believe what's happening to me. And she kind of gaslit me too. So it's like, when your own mom doesn't believe you, do you really think a doctor is going to believe you? I mean, mine did. And I'm one of the few where my doctor believed me. But I know almost every person I talk to, their doctor does not believe them.
How did it affect your perception about medicine, about your role in medicine, about your relationship with medicine? What was the impact of this experience for you?
I always say I have to be dying on my deathbed to like make somebody give me a medication again. Even
Wow.
just things you get over the counter, I don't want to take anymore, which I don't know. I get there's a time and a place for them if somebody is actively dying, but there's no way I could work at a hospital and give these medications to people knowing like what they can do. So it's changed it totally for me.
Okay, I think it was interesting what you were saying because I've had this fear mongering argument from people trying to shut you down when you talk about your experiences. I've experienced that a lot
Yes.
myself. Um, I find it very curious because we're told to open up about mental health. We're encouraged to talk about mental health. We're encouraged to destigmatize people with mental health problems. We're encouraged for people to share and be open about their emotions, and we're encouraged to be compassionate towards those people who have suffered. Why is it then that when people with our experience go out and tell their story, that they are negated and asked to kind of keep their mouth shut? Why do you think that is? And how do you feel about that?
You know, Daniel, I ask myself this question every day. I really do. And it's the biggest problem that I'm seeing right now. And I think one day it's not going to be this way because enough people are going to be talking about it. But I think it's something that is new. Well, it's not new, but it's new in the way that it's coming. So many people are coming out experiencing this. And also, I think so many stories about this go unreported because people they're not understanding what's happening to them.
Hmm.
My twin sister, I have a twin. She
Hmm.
cold turkeyed off Lexapro. I did not know she did that. She had to live with my parents for a whole year. She developed all the symptoms I have, but worse. She was almost diagnosed with MS because the doctors thought that she had MS. Like, that's how much it can completely get misdiagnosed.
So now we get on to the good part, right? So we talked about we've talked about your journey from starting off having anxiety, becoming medicated, taking on that kind of diagnostic label, having initial positive results, and then slowly kind of creeping negative results, a prescription cascade, slowly starting to question it, going through tapering, getting hit by the tapering, and then sort of starting to question the whole paradigm. Um, so what? So where are you now? Now that I know you're still tapering, but where are you in terms of how you define your story? So if we think about the story that you that was given to you, that you have this kind of brain condition of general anxiety disorder, and you need to take this medication to correct this. What do you see your story now? How do you define your story, and what kind of language do you use to define who you are and where you're going in relation to the medical industry and how it defined you before?
That's a great question. I'm kind of still trying to figure that out, but I know that it does not define me. Anxiety, depression, which I did not have, but they said that I had, does not define me. Um, I think there were things from my childhood that I needed to work through, and no one really ever gave me a chance to even try that first. They kind of just, we went to medication and that was it. Um, and now I know that quick fixes are not always the answer. And a lot can come from trying to have a quick fix. And obviously, to research anytime in the future if I ever do want to go on something again, which I do not think I ever will. But to just be more aware of what you're putting into your body before starting, and
Hmm.
also things you can do naturally to help anxiety, like giving up alcohol, which I have, and giving up caffeine, and a bunch of other things that can cause anxiety to get worse.
Excellent. And if you could go back, looking at your journey, how would you have done things differently? So, from that first panic attack that you had, what would you have done differently, knowing all the things that you do now?
I honestly don't know if I like in that moment that's what I needed, and I kind of give myself grace for that because I thought that I really needed a quick fix in that moment, and it did help me in the beginning. But obviously now knowing the harm that it has caused me, I can't even exercise anymore because I have so many problems with my heart and other things. I used to weightlift every day. I would have never taken it. I'm just gonna say that.
I see. So, obviously you worked as a nurse, you worked in the medical system. How do you interact with that? You no longer work in that system, but how do
Hmm.
you how do you feel? How do you interact with them? Do you have friends still in that profession, and how do you talk about the issues that you have with those people?
So, yes, I have a lot of friends that are still in it. And I've kind of learned to not really talk about it with people that don't understand. I don't know if that's healthy or not, but just the reactions I got from the few friends and family that I did talk about it with, it's almost like you're not, I don't want to say talking to a brick wall, but pretty much because if somebody hasn't felt these things, then they have absolutely no idea. So I kind of try to stick with um, people that are going through it or have gone through it if I ever really need to talk to people about things. And then I do have the friends that they don't understand what I'm going through, but they're still supportive and I talk to them. But as for people that I was acquaintances with, um, but the people that commented negatively on that one post that I made, I almost let that stop me from talking about it, and I'm glad that it didn't. Because I feel like the more symptoms I develop and the harder it gets, the more I just want to keep talking about it and sharing my story. And I tell other people too who tell me they're like, I should start talking about it. This happened to me. I'm like, please start talking about it because we need more people to talk about this.
I have the same thing. I have friends where I was suffering extremely from withdrawal, and I told them the reasons why it was a medication, and they just kept on going, speak to a professional, speak to a professional. And I was like, the professionals don't know what they're doing. They don't have any clue.
That's the
They're
dangerous thing to do. Yes.
Yeah, I was like, I can't go to the professionals. All they'll do is offer me more drugs and say that it's my underlying condition, whatever that is. And so then you get in this situation where your friends think you've lost the plot, that you've like just gone down some kind of rabbit hole. Also, you mentioned your sister. You said your sister had went through it. So does she recognize that it's withdrawal now, or does she still believe it wasn't?
She knows now, but it took a long time because I didn't even know what she was going through at the time because her situation happened before mine did.
Okay.
She went to so many different specialists and that's like another rabbit hole somebody can go down is you go to one doctor, they send you to another doctor, and then you end up on a bunch of meds that you don't even need.
Why is it that people react so strongly to you just telling your story? Because that's literally all you're doing. Why are people so aggressive and so, I mean, frankly, can be quite callous and unempathetic? Often by people who consider themselves to be very empathetic, caring people, can suddenly turn into very callous people when confronted by people talking about medication harm. Why do you think there's that strong reaction?
I almost feel like the word withdrawal is there's just so much like negativity around it that whenever I say that word to people who don't know, they almost think I don't know if they're thinking about alcohol and drug withdrawal when I say it and they like don't want to talk about it because it's uncomfortable. But that's almost the vibe that I get when that happens.
Yeah, exactly. Like you're kind of shaming them. I do agree. I think it's really interesting because it's almost like divide and conquer, that you get the people that are having good experiences with the drugs and people that have a bad, like end up being at each other's throats. And I do feel like sometimes people in our community, we kind of make the same mistake. If we can't expect other people to believe our stories about the harm that medication causes, and then at the same time disbelieve other people that have had good experiences. You know, we've got
Right.
to. And I feel like that's the trap that some of us fall into. We're like, no, you're just feeling placebo, or it's spellbinding, and maybe it is. They are just oblivious to the to the bad effects over time. But it could also be that they are just genuinely doing okay, and it's not really our place to
Hmm.
question that. And I think the analogy I use as well is kind of similar to what you said. Is I feel like telling people who are on a particular psych medication that it can really be incredibly harmful and damaging is a bit like calling someone up on a plane and going, hey, I heard that plane that you're on and that airline, like they crash all the time. Like they're all, they've crashed like
True.
4 times this year. Did you know about that? What do you think about that? I mean, how is someone who's on a plane with that airline being told that that airline has a lot of planes crashing going to react? They're not going to be they're not going to be like, oh, thank you for telling me that while I'm in the middle of a flight. I really appreciate that information. You've really helped me there. They're going to push back, right? And
Hmm.
and I feel like something similar happens with the psych med things. Do you have any thoughts about how we can engage with those people besides just accepting their point of view? Or
That was a good comparison you made with the flight. I've never thought about it like that. That's good. But I
Mhm.
think maybe like the way I do, I try to just share my story, and then if people relate to it, they relate to it. I'm not telling people ever to not take these medications because, like you said, some people do totally fine, and
Yeah.
that's fine. But I, as well as so many people, have had negative experiences, and I feel like our voices deserve to be heard too, not just the people that have good experiences.
Absolutely. Our stories matter just as much as anyone else's. And I notice, you describe yourself as that functional nurse. So tell me a bit about functional medicine and how it's helped you on your journey, and yeah, how it's now part of your story, I guess.
Yeah, so that functional nurse, that's what I made my Instagram and my TikTok account name because when I was on, like I talked about when I was on that 4 milligrams and I had a year to kind of recover, I had developed that rash all over my face. I noticed that it got worse when I ate certain things.
Hmm.
If I drank alcohol, if I drank caffeine. So I kind of had like this 3 month period where I did an elimination diet. I cut out gluten, dairy, caffeine, alcohol, and I saw so many improvements in my body. And then I ended up seeing a functional medicine doctor who he did what's called a GI map, which looks at my gut and things like that, which gut issues can cause anxiety and depression too. So that's really important to make sure you don't have parasites and things like that. But I will say I've had to take a break from it because I'm in such, it doesn't look like it right now, but I'm in pretty bad withdrawal normally right now. And so I haven't been able to, a lot of functional medicine is supplements, and I've had to cut pretty much all of those out because they make my symptoms worse. But I do think that functional medicine, getting to the root cause of anxiety and depression and just health issues in general, can make so much of a difference. I have started acupuncture, and I mean, some people hate it, but it's really helped me with some of my symptoms.
Interesting. And what sort of yeah, because I think this is another thing, another debate, and reflects like the polarization we're seeing as well that we can get caught up in. Is there's this kind of debate about there's increasing skepticism about conventional medicine and conventional practices. And on the one side, you've got the kind of people that are sort of trust the science, um, like trust what the conventional scientific authorities say, and then on the other side you've got like, no, we can't trust them, they're too corrupted, too captured, we want to do this other stuff, and then the trust the science people are like, you're a bunch of woo-woos. For example, I know people that have definitely benefited from acupuncture, but there are some people that say, oh well, it's unscientific, it's just part of the wellness industry, etc. What would you say to people that said that?
Well, I would say that we have billions and billions of dollars in conventional medicine for all this research. And there is research in conventional medicine, but I am seeing constantly every single year when I was in the hospital, I was in the hospital for 7 years working, I saw patients getting sicker and sicker and sicker. And we were not helping anybody. So I would say, how do you explain that? And how do you explain how I have not been like physically sick? I used to get sick all the time, like sinus infections, strep throat, everything, when I was on birth control and my full dose of my SSRI. And since I came off birth control, started to taper off my SSRI, I have not been sick once. And I don't think that's a coincidence. I feel like we've kind of spun out of control in the conventional medicine world, and we're not helping people anymore. But then you see people go and they get functional medicine, they get acupuncture. There might not be enough research on that, but I don't think they're funded by pharma like the research is for conventional medicine.
Yeah, interesting. I'm getting a few things out there. So one is like, let's look at the conventional medicine results. Are they good? But there's also something about specialization, right? And I think one of the ways that you've reclaimed your narrative is you're looking at the whole picture, right? You're looking at your diet, your lifestyle, that holistic approach to everything, rather than this kind of very narrow, specialized, just let's sort this thing out. Because quite quickly, that's how you can get this cascade of problems, right? Because you can take the psychiatric medication that can cause a gut problem. So you go to a gut specialist, they give you a medication for that. Then that causes sleep problems. It's not like they all get together as a team and go, okay, this is what's happening with Amanda. Let's put our heads together and like work out a plan. No one ever does that, right?
Exactly. And there's a lot of times no follow-up, and it can lead to really dangerous things with your health, and people like myself don't realize that it's the medication that's doing these things.
Yeah, you've moved away and taken back control of your own story. How do you think once you've completely got off the medication, and you're back to full health? How do you see your life then? How are you going to live your life differently from the way you were living it on medication? And what do you think are going to be some of the positives and maybe negatives as well, potentially? How do you envisage your life once you're completely off, and how are you going to live it?
Just definitely more thankful and grateful for life, and being able to function correctly. I dream about that day, but it's gonna probably take me 2 more years to taper off fully. But definitely just being able to have the simple things and actually be able to tolerate it. Like right now, I can't even drink a cup of coffee in the morning anymore because it sets off my nervous system so much. So I feel like I'm just gonna, right now, I'll go on walks and I see colors brighter than they were before. And so I'm already so much more grateful for the trees and things like that I never used to care about when I was younger. And also it had me, like I've talked about several times, give up alcohol, which is a huge change. And that's a whole journey in itself. But also I feel like this all has allowed me to kind of dive deep into important issues, and hopefully I hope to one day help people with going through what I've been through. And I don't know what that looks like yet, but I hope to one day help people with that. As for dealing with my anxiety, haven't really thought about that yet, but I'm kind of finding natural ways to deal with it.
Excellent. And just to wrap up, do you have any kind of final thoughts in terms of this experience and something you'd like to share with people watching about your experiencing and if they have similar experiences, anything you could share about your experience that might inform theirs?
So first, make sure you have a doctor that you can trust that's going to listen to you. I
Hmm.
always say if you have one that gaslights you, says what you're feeling is anxiety, which it might be, but if you're having a bunch of other symptoms, it's not just anxiety. And to listen to your body, like you did not have these symptoms before you were on the medication. You're coming off, you're having them. Just like, I don't know, just listen to your body is what I always tell people. And you know it better than any doctor. So just because a doctor is saying you have this, you need to take this, like question it a little bit before going on it. And also just do research. If you're thinking about going on these meds, do full research before doing it. And also know that there are people who have been through this and are going through this and that can help you. Um, there's several resources. I'm obviously not going to list them now, but Inner Compass is great. They have a bunch of resources. Um, and yeah, good luck if you're going through your taper, and you'll make it through, even though it's probably going to take a long time.
Excellent. Thank you, Amanda. Thank you so much for sharing your story and giving us your insights. It's been a pleasure having you.
Thank you for having me.